We're back now at 6:44. You know, these are stressful times we are currently living in. The new coronavirus has so many of us changing up our daily routines on a daily basis. So to help us navigate this new normal, psychologist Amy Sullivan with the Cleveland Clinic joining us live on the phone this morning. Good morning to you, Dr. Sullivan. You know, so many right now are working from home. Our kids are at home. We're worried about loved ones getting sick, worried about ourselves getting sick. The stock market is stressing us out. There is so much going on. Help.
I know. Hi, Katie. It's good to talk to you again. One of the things that I've thought about as we've gone through this is how much control humans enjoy, and I think that this is such a time of uncertainty. And so, I'd love to provide some tips for our listeners. And first and foremost, I've heard you say this over and over again, is that we're all in this together, right? And so I think that this is a time where we need to comfort those that are scared, particularly our children. And I've heard our children come home with a lot of misinformation, and our elderly who are also at risk. And so I think it's important for us to really call them, make sure that we're FaceTiming with them and connecting with people in a safe way. And another thing that I think is important for us to do is to plan some coping activities. So I think this is a time where we can really be creative and come up with things that are helpful for us to cope with. So things such as yoga, things that are calming to us, like doing some breathing activities or taking hikes outside, playing with our kids, playing with our pets, just doing creative things is going to be really important for us to cope. And then I think what's also important is that if your anxiety or depression is something that is really unmanageable, there are ways that people can see a mental health practitioner. I know our practice has converted to virtual, and I know most of the Cleveland Clinic is doing that right now. And so there are avenues for people to get help with their anxiety or their depression.
Really quick, you mentioned it, but I know you shared a story on Twitter personally about your own daughter. What is the most important thing to remember when we are talking with our kids about what's happening right now?
Yeah, thank you. So I think with our own children, they are getting misinformation. And so it's important for us to just connect with them, sit down with them, and make sure that they're getting information from us, and making sure that we limit their exposure to the news, to the media, and to make sure that they're getting their information really from us that is at their age-appropriate level.
And finally, Dr. Sullivan, I know you work a lot with addressing the mental health needs of your coworkers in the health industry. Our doctors and nurses are on the front line of this outbreak. What is important for them to know right now, or what are you thinking about in regards to them?
Yeah. So for me, again, having that virtual ability to connect with our coworkers, our colleagues, they are on the front line and they are at risk not only for, developing the virus and bringing it to their own families, but their own burnouts. And for me, making sure that our doctors are taking care of themselves. So again, managing their stress, making sure that they're coping, doing some self-care activities, and just taking care of themselves from an overall perspective is very important. And we are there to help them as well. And so again, we offer virtual capabilities so that nobody even has to step foot into a clinic right now.
All right. We appreciate it so much for your time and thinking about us, and as we think about each other as well, like you reminded us to do. Dr. Amy Sullivan, a psychologist with the Cleveland Clinic, probably will be checking back in with you. All right.
Yeah.
Thank you so much.
Katie. Thanks, Katie.